Our arthroscopic approach is medial, and landmarks are a little bit confounded in this dog due to the remodeling process and the arthritis that's present. But basically, we tend to make two portals about 1 centimeter to 1.5 centimeters apart from the medial side. And typically, the caudal one will be the arthroscope, that is the one towards the back, and the cranial one would be an instrument portal if we're going to use that. This one obviously is not going to involve an instrument portal, but again, for typical arthroscopy, and you can make comments about the adjustments to the technique, we would place a needle into the joint first. We would distend the joint with sterile flush. Then we would place a second needle, in along the arthroscope portal, just to define the path, and we would know that we're there because the flush would come out. And then we would pull that out, make a very small stab incision with an 11 blade, and maybe with a hemostat tunnel our way down to the joint capsule, and then push the trocar with the cannula down into the joint. And once we were convinced we were there, the trocar would come out and the camera would go on. So I assume that's basically the same technique without the preliminary joint distension.
In horses, we sometimes do that. It just depends. If we're doing a typical arthroscopy, we always distend the joint initially, and then we'll go in.
But not with this system so much.
Scope, I can't remember with the stifle.
Grant did not, and Gil doesn't either. He doesn't usually
Right.
descend unless it's absolutely necessary. What he does do is put a little flush in the portal just to get the image clean. If there's
Sure.
any loose bodies or blood or whatever, like
Sure.
that. And then if you find you have to descend, then you can, but usually it's not to.
So we'll have an assistant ready here with a bag of saline.
Okay.
Right, they can pull up 10 mils or 12 mils, right, in the syringe.
Yep.
So load onto the cannula as necessary to flush a little bit through. Is that
Correct. This is the cannula here, trocar, and then you have the unit, the condom then goes over it. Grant, by the way, does sterilize, I guess, and uses this is different, even though it's a one disposable.
Yeah,
Apparently does use
We
it.
have
Yeah,
examples of it.
he has used it before, but this is a new one. So you can see there.
I think the only thing when doing the